Hi, my name is Dr. Daniel Petrylak. I'm Director of Genitourinary Oncology at the Smilow Cancer Center at Yale University. Most of my patients who have bladder cancer are often very surprised. They're surprised when I tell them that this is a smoking-related illness. And then it suddenly dawns upon the patient that the same carcinogens that may be filtered by the lung also can be concentrated in the urine. And we believe that bladder cancer is a disease of smoking. It's also a disease of chemical exposure. Bladder cancer is responsible for approximately 13,000 deaths in the United States. It predominates in men rather than women. And it often presents with blood in the urine, urinary tract infections, or other urinary symptoms. When bladder cancer invades into the muscle of the bladder, that's when we need to start thinking about giving chemotherapy or taking the bladder out. And that's where the oncologist plays a role. So there is a form of chemotherapy called neoadjuvant chemotherapy, which means that we give chemotherapy before the bladder is taken out in order to shrink the tumor and also to potentially improve survival. So there were two trials that were performed, one in the Southwest Oncology Group and one in Europe, that looked at giving two different chemotherapeutic regimens. These are multi-drug regimens prior to taking the bladder out. And what was found in both trials was that there was an improvement in survival. In fact, in this study in the Southwest Oncology Group, those patients who had their bladder cancer completely go away, and that's about 1 in 3 after chemotherapy, survived, 85% of those patients survived 5 years. So we believe that chemotherapy is an integral part of the management of locally advanced bladder cancer. Your doctor also may discuss with you the possibility of giving chemotherapy after surgery. And although there's less evidence for this, it is something that is appropriate for a patient with high-risk disease, namely if the bladder cancer invades into the fat around the bladder or if it spreads to the lymph nodes. We're currently looking at a variety of different investigational ways to improve bladder cancer survival. Interestingly, bladder cancer has some tumor markers that are similar to breast cancer. One marker is called HER2/neu, and there is a drug that targets HER2/neu. It's called Herceptin. We are looking at a vaccine to give to patients after they've had their bladder out, which targets HER2/neu. And we feel that those patients who express HER2/neu may have an overall aggressive course, which would merit using a vaccine in this situation. Chemotherapy for bladder cancer has been unfortunately at a standstill for the last 20 years. My late mentor, Dr. Alan Yagoda, developed a 4-drug regimen called MVAC, which is still commonly used in patients with the most advanced forms of bladder cancer. Unfortunately, we haven't improved upon the survival that was seen with MVAC, and we're looking at a variety of different combinations of drugs to improve that survival. We're looking at drugs that target heat shock proteins or proteins related to stress in the bladder. We're also looking at a variety of different second-line treatments after patients either progress or don't respond to their initial chemotherapy. So you should discuss with your doctor potential clinical trials that you may be eligible for. And this will certainly help us understand more about the disease and potentially could benefit you in the long run.